How to create a perfect skincare routine for acne-prone skin. Well, let's think about it. What kind of acne does one have? It really depends on that. But at the end of the day, there are a few ingredients that are essential for acne-prone skin. Acne-prone skin can be oily, can be combination, and it could also be on the drier, dehydrated, sensitive skin spectrum too. So let's talk a bit about the ingredients that are required to build this. The first and foremost ingredient as a dermatologist that we recommend our patients to incorporate into their skincare routine would be benzyl peroxide, because it's anti-inflammatory in nature. It especially helps the red type of acne, and benzyl peroxide can be used in a cleanser or in a gel or in a lotion format. The second would be a retinoid. Retinoids could be retinol, it could be adapalene. Adapalene is a prescriptive retinoid that doctors and dermatologists prescribe for acne-prone skin. There are now some over-the-counter products which do have adapalene in them. It increases the cell turnover, it reduces the inflammation of the acne and helps calm and soothe the acne skin. Retinoids, on the other hand, could also just be retinol itself. Retinol is more of an anti-aging product rather than an acne product. Adapalene is more preferred than retinol for acne-prone skin. In a dermatology practice, we may also prescribe tretinoin to your skin type, because tretinoin is the prescriptive form, and that is at least 20x stronger than an over-the-counter product. So this is depending on the grade of the acne. The next ingredient is azelaic acid. Azelaic acid is antimicrobial, it's anti-inflammatory, it also reduces marks and pigmentation on the skin. So this can be used on a daily basis when there is inflammatory acne, when there are post-acne marks and scars. The next ingredient is salicylic acid. Salicylic acid is also known as a beta-hydroxy acid. This is a lipid profile acid. What I mean by that is it works well with oil, and most times acne is because of excess oil production or there is clogging of pores with oil, and this is where a salicylic acid comes in handy, because it increases the cell turnover, it helps with the whiteheads, the blackheads, which is the comedonal type of acne, and it helps with the whole exfoliation and cell renewal process. The next active ingredient that we look at is really antibiotics, which are prescriptive in nature, which can be only used on prescription. So we use clindamycin typically. Sometimes in resistant acne we can use nadoxin, we could use dapsone. So these are the various different prescriptive medicines that we would prescribe. Next active ingredient is niacinamide. Niacinamide actually has become the new favorite for over-the-counter active ingredients for acne-prone skin. It helps with the oil control of the skin, it helps with the skin barrier repair, it's anti-inflammatory in nature. So niacinamide is another pick. Along with this, there are two other ingredients that do help with acne, which is sulfur and zinc. These are anti-inflammatory, which help with immediate shrinking and healing of acne marks and acne spots. So how do we build the perfect skincare routine for acne-prone skin? It always is about the 5-step routine: the cleanse, the repair, the nourishment, the protection, and the boost. So you cleanse with a pH balance cleanser, because already the skin is sensitized and the barrier is broken. Along with this, if the skin is quite oily, a benzyl peroxide cleanser can be used. Even a benzyl peroxide foaming cleanser can be used for the body acne, because a lot of times acne is just not on the face, but it can be also on the chest, the shoulders, and the back. The next step is the reparative. So a salicylic acid serum, niacinamide serum, something with retinol, something with azelaic acid. A combination of these would be good. If you're using a standalone, then in the daytime it's preferable to use a niacinamide azelaic acid combination and save the salicylic acid and retinol for nighttime use, because both of these are photosensitizing, which means it can make your skin get sun damaged and pigmented. The next step is nourishment, so a ceramide based moisturizer. Not squalene but ceramide, because you want to restore the skin barrier, take away the skin's sensitivity. The next is protection. Don't forget that sunscreen. Even if you are staying indoors, the sunscreen is critical. So sunscreen is the next step. So to recap, the day routine is the cleanser, the serum, the moisturizer and the sunscreen. What about at night? At night, after cleansing the face, so cleansing the first step, second step would be to use the reparative, which is the serum with the actives, and the third step would be the moisturizer. If you're on a prescription program, then you would use a prescriptive care more at night and follow it up with your ceramide moisturizer. So 4 steps in the day, 3 steps at night is the perfect skincare routine for a daily basis. This is not enough on its own. The skin is an active process. Every 28 to 30 days, we get new, fresh skin. And when there is acne on the skin, it leaves behind marks, it gets clogged. So the cell renewal, as we call it, is critical and important. So this is where we need active exfoliation, but we also need masking after the active exfoliation for Indian skin or skin of color. Otherwise, the active ingredients will leave the skin open and it can get injured further and clogged further. So using a clay mask with a build-in of active is ideal. Once a week for mild acne, moderate acne, which means more than 5 breakouts on a monthly basis, right? More than 5 in a month means moderate acne. You would use this on a weekly basis, 2 to 3 times a week for 72 hours. And then if you had more severe acne, you would definitely be seeing your dermatologist for the grade 3 acne where you're having more than 10 to 15 breakouts per month. Dermatologist prescription plus the acne mask, which becomes your boost step. So this is the way to build a perfect skincare routine for acne prone skin. 4 steps: cleanse, the treatment step with the serum, the nourishment with the ceramide moisturizer, and the protection with sunscreen. And at night, 3 steps: the cleanse, the treatment step with the serum or the prescriptive and a ceramide moisturizer, and on a weekly basis, the masking. This would be the ideal routine. And just using this for a month is never sufficient. Acne, when it injures the skin, it is a 3-month process to be done consistently. And consistency is always the key to healthy, glowing skin. So if one wants relief from acne marks, then it's important to use the skincare routine for at least 3 months consistently to get the results. Do like, comment and subscribe to our YouTube channel and leave your comments there, because this motivates us to make more content and get content ideas for what you need. Also share with your friends who may find this useful.